All this week, we're focusing on ways to get your kids ready for school, and that includes getting them vaccinated.
Q13's Marnie Hughes is here with some advice. Back to school is right around the corner, and parents are the first ones with homework. This year in Washington, the state legislature passed a bill that no longer allows parents to opt out of required school vaccines for personal or philosophical reasons. So do not wait to make an appointment with your primary care physician unless you'd like to wait in line. Kids entering kindergarten now need the MMR vaccine, which stands for measles, mumps, and rubella. It's also recommended that they are up to date on the polio, DTaP, chickenpox, and of course the yearly flu. For kids 11 to 12 years old, they should receive the Tdap, the HPV vaccine, meningitis, and also it's recommended that they get their flu shot. Here to talk to us about the importance of back-to-school immunizations is Dr. Ari Gilmore with Pacific Medical Centers. Thanks for being here.
Oh, thanks for having me.
So why is it so important that parents get their kids vaccinated before school starts?
Well, like you said, it now is harder to be in school with an opt-out, but additionally, it helps protect them when they're around all the other kids from getting communicable diseases that can be really serious, but are easily prevented if everybody gets their vaccines.
As I mentioned, the law has changed, so a lot of parents are aware of that. Before school, you're going to need to make sure that your kids are vaccinated. What advice do you have, though, for parents who are concerned and who have opted out in the past?
Yeah, I think the first thing I would tell them is go talk to your doctor about what you're worried about, what you're concerned about. It's a dialogue. We want to engage people, hear what their concerns, their fears are, help them understand the benefits, and if there are risks of vaccines, and hopefully we'll have a fruitful conversation and they'll end up deciding to go ahead and vaccinate.
How about teens and kids entering college? We talked about a lot of the younger groups and what their requirements are. If you're heading off to college, do you need to be vaccinated?
Yeah, we really like our young kids to be vaccinated with the HPV vaccine before they head off for college. You mentioned that one. That's a series that has had some resounding success. In fact, it's so successful. It used to be 3 shots for the series. Now it's only 2 if you start it before 15. And we're seeing big reductions in genital warts and abnormal pap smears later in life for young women, and we hope to see reduced risks of cancers later on for both men and women, so it's a really important one.
How about people who are nervous around needles? I know a lot of kids don't like to get the shots. Do you have any tips to help ease their concerns?
Oh, that's a good question. Number one, all the nurses are so good. Really what you feel mostly is they pinch their skin. Just being really matter of fact, promising a treat afterwards is fine. And some doctors' offices, if you tell the nurse or physician ahead of time that your kid is really going to have a hard time with it, there's things they can do. Putting something on to numb the skin, doing a spray, doing it in a different room. Sometimes kids begin to associate the same room over and over, especially the little ones. They start crying when they come in the office. Okay. So we can do things to switch it up for them.
All right, good to know. The idea is don't wait. Offices like yours will get pretty busy. Yeah, don't wait, vaccinate. So if you'd like more information on vaccine requirements in Washington, or you would like to see more of our Healthy Living segments, go to Q13fox.com/healthyliving.